Hello, I'm Christian from the DGSA. In a series of videos, we would like to show you the palpation of different muscles where people often have difficulties with. We think that palpation is not only important for dry needling, but also for manual trigger point therapy and for the examination of patients in general. Today, I would like to show you the palpation of the ileopsoas muscle distally of the inguinal ligament and how to differentiate it from neighboring structures. So, let's have a look at the anatomy first. The iliacus muscle and the psoas muscle converge to the ileopsoas muscle, which we will palpate distally of the inguinal ligament. The ileopsoas lies within the femoral triangle, just medial of the sartorius muscle. The inguinal ligament can be localized between the ASIS and the symphysis. The femoral triangle is defined as the area between the inguinal ligament, the sartorius muscle, and the adductor longus muscle. Before we palpate in the femoral triangle, we have to know the structures there. From medial to lateral are the femoral vein, artery, and nerve. In addition, we will find lymph nodes, which are scattered mainly at the medial part of the triangle. Now let's go to practice. So here you see the femoral triangle. The femoral triangle is defined as the medial border of the sartorius, the lateral border of the adductor longus muscle, and the inguinal ligament. The inguinal ligament comes from the anterior superior iliac spine and goes down to the symphysis. The sartorius can be defined by letting the patient lift the leg in the sign of 4 and the adductor longus can be defined by letting the patient press the knee against medial. So the adductor longus is the most prominent or dominant muscle of the adductors. Then, before we palpate in the femoral triangle, we have to palpate the femoral artery. Now, if you palpate the femoral artery, you have to palpate the point where you feel the pulse the most. So basically you can feel the pulse from here to here, but you have to locate the spot where the pulse is the strongest, which is here. So this is the femoral artery. From inside we have first the femoral vein, femoral artery, and the femoral nerve. Also, before you palpate in the femoral triangle, please check if there are any swollen or painful lymph nodes. I feel lymph nodes here, and I feel some lymph nodes here, but they feel normal and are not painful for the patient. So the ileopsoas runs in a dorsolateral direction towards the trochanter minor. The best way to palpate the ileopsoas distally of the inguinal ligament is to palpate it just around the medial border of the sartorius muscle. For that, contract the sartorius muscle again, and then palpate with your thumb just around the medial border of the sartorius muscle. And then let the patient flex the hip in an active assistive way, and then you can feel the ileopsoas muscle contracting toward your thumb. So that's it. Trigger points in the ileopsoas muscle distally of the inguinal ligament are a very common cause of groin pain. So therefore I think it's important to know how to palpate the ileopsoas muscle there correctly. So I hope you liked this video, and don't forget to join us on YouTube, Facebook and Instagram.